ambulance emergency. Is the patient breathing?
Yes.
And is the patient conscious?
Yes.
Okay, tell me exactly what happened.
My friend Jane.
Okay, great.
Hi everybody, how are you getting on, Jay? All right, is that morphine working? Is it kicking in? Yeah? I think you're very brave, you're doing very well. Ready? Yeah. Right then, here we go, and back up.
We're just going to get you off here now. All right. We'll pull bumps as we go down here. All right. You're there now.
That's it, just take deep breaths, Jay. A little bump here, mate.
You ready?
You all right, Mel?
Yeah.
We'll be gentle, don't worry.
That's it. You okay?
Hi Sonia, we brought you another one. This is Jay Perez. He's 18 years old. He's had an incident with a car. So he's got a bit of an abrasion on his head, no C-spine tenderness, no loss of consciousness. He's got a laceration on his arm, which we've dressed and covered, and tib fib as well, which is splintered. We've given him some morphine, but I think that cameo might have blown. He weren't flushing properly that last one. It's just while he's been on his phone, while this has all happened.
Oh dear.
So heading phone. Yeah.
Okay, thank you, Mel.
No worries.
Hi, Jay. My name's Sonia. I'm one of the emergency nurse practitioners. How are you feeling?
Not great.
Not great. I'll be looking after you today, okay? I can see you've got a nasty leg wound there. Yeah. Are you in any pain? You look like you are. A lot. Okay. So what we'll do is I'll have a look at your leg wound in a minute, but what we need to do is get some bloods from you.
What
Okay.
for?
So just because you've got that nasty leg wound, you might have lost quite a lot of blood. I don't know how much blood was at the scene. So
Yeah.
what we'll do is we'll make sure that we've got all them blood tests already sort of down at the pathology just in case you need them.
Okay.
All right. I'll also give you some pain relief because you look like you're in agony. Yeah, you're not allergic to anything that you know
No,
of?
no.
Good. Just give me 2 seconds and I'll just go get all the things that I need. Right then, Jay. What's your full name, sweetheart?
Jay Perez.
And your date of birth?
14th for the 3rd, 2003.
Lovely, right, okay. I'm just going to pop these just here, just while I pop my gloves on, pet. I'm going to pop a little cannula in your arm. Alright, might sting a little,
Okay.
but it'll only last a second.
Alright.
Wonderful. Let me just have a look at your arm, sweet. Thank you. Oh, you've got some nice veins there. Wonderful, right then. Great stuff, well done. Sorry, did that hurt a little bit?
Just a bit.
Just a little bit, okay. You've been really great, well done. Fantastic. And you're not allergic to anything that you know of?
No.
Lovely. So I'm going to give you your morphine now, pet, alright?
Okay.
This might make you feel a little bit woozy. Oh, sorry, I'm spilling. Just stick that down. Right then. Definitely not allergic to anything?
No. No.
Wonderful. Right then. Okay, so I'm starting to give it now. I'll give it really slow because it can make you feel a little bit sick. Can you feel that? Yeah. Well done. Has your pain gone away? I know you're really worried about your wound on your arm, Jay, but I'm not so worried about that. I'm worried more about your leg. So before we do anything else, now you've had your morphine, we're going to get you down to X-ray.
Okay.
We need to make sure what's going on down here.
Yeah.
When you get back, I'll sort your arm out.
Alright.
Alright, just because you've still got morphine on board and you're still a little bit drowsy, one of our health cares will go with you when the porter down to X-ray.
Alright.
Okay.
Hi Sonia, just come to check on Jay. We brought him in earlier.
Hi Jamie, yeah. He's doing alright, as you can see.
Hey up, Jay, you all right?
So he's just been to X-ray. He's got that nasty wound on his arm that you dressed earlier. I'm not worried about that though. I'll deal with that later. It needs closing, but it's fine. I'm really worried about that leg. So he's just come back from X-ray actually. I don't know if you want to have a look.
Yeah, I do, yeah.
Oh dear. So the tib fib.
Yeah.
Distal third fracture, as you can see, it's really, really obvious. That's nasty, is that?
Is he going to need an operation for that then?
Yeah, I'll be referring him to orthopaedics. The plan of care will then be devised, but that needs to go to theatre.
Yeah.
I'm really glad I did that X-ray so soon, actually.
Right. Hope he's all right.
He will be. Hi, Jay.
Hi.
Hiya, how are you doing?
Alright.
Good. I've had a look at your x-rays.
Okay.
And as we suspected, you've obviously got a broken leg, but we knew that anyway, didn't we? Yeah. That break in particular needs to be referred to orthopaedic surgeon.
Okay.
Alright, she'll be down, or he, I don't know who's on call, will be down shortly to take your consent. It will need to go to theatre. You need an operation.
Does that mean I have to stay in?
You do. You'll just have to stay in a couple of days before you can go home, but we'll take good care of you.
Alright.
You look worried, are you alright?
Just a bit nervous.
Nervous? Don't be nervous, we'll look after you.
Okay.
Alright, we'll wait for orthopaedic surgeon to come and take your consent.
Alright.
Alright, lovely. Oh, this room's looking great now, Jay.
Yeah. Okay. That's good.
Just one more and then we'll be sorted.
Alright.
What would you have been doing today if you weren't with me?
Oh, nothing special.
Nothing special.
Just shopping.
Shopping?
Yeah.
Anything nice?
Just bread, milk.
Normal everyday stuff.
Yeah.
Excellent. Right, that's me done. Let me just snip this end off. Lovely. All done, nice and neat. Alright, you've got 7 stitches in there. The commuter nurse will take them out when you go home.
Okay.
So you don't need to worry about that.
Right, boss.
Alright.
Come about some blood. This
Yeah.
one.
Can you just take those down to labs for me, please?
Yeah, no problem.
Right, thank you.
Hi Jay, I'm Alistair, one of the anaesthetists. I met you down in the emergency department.
Yeah.
This is Linda, the ODP, who's going to help me put you off to sleep. Okay, so I've finished with my questions, so I'll hand you over to Linda to finish hers.
Okay, hiya Jay.
Hi.
I know Alistair's asked you a lot of questions already while you've been in emergency department. I just need to ask you them again while you're in here, okay? It's just double checking, it's routine stuff while you're in theatres.
Yeah.
So first thing I want to do, can you confirm your name and your date of birth for me?
J. Perez, 14th of March 2003.
Okay, that's right, and then we're just going to check your consent form. So it's your right leg we're operating on, is
Yes.
that correct? And can you tell me, is that your signature on there?
Yep.
Okay, that's good. So just a couple more questions now. So can you tell me, are you allergic to anything at all?
No.
And when did you last have anything to eat or drink?
About 8 o'clock last night.
Okay, that's good. And have you got any loose teeth, caps, crowns,
No.
anything at all in there? I just need to have a little look at your leg. Have they put a mark on it on the side
Yes.
that we're doing? I'll just check that. Yeah, that's fine. Okay.
Okay, right, we're ready to go. So I'm just going to come around. I'm going to lie you slightly flatter. Okay, and then the first thing we're going to do is give you some oxygen to breathe. Through a clear mask, can we just hold it gently over your nose?
Okay.
And then take some nice slow deep breaths. And we'll start getting you off to sleep, okay?
Yeah.
Okay. Okay, you're going off to sleep then.
Okay guys, we're ready for team brief, okay? I'm Gail Eden, I'm the theatre assistant in charge of the list today. Can we introduce ourselves by name and role, please?
My name's Miss Lugins. I'm consultant orthopaedic surgeon.
Sandra, radiographer.
Erin, Miss Lukin's assistant today.
I'm Dave, healthcare assistant.
I'm Linda, operating department practitioner.
I'm Alistair, consultant anaesthetist.
Okay, we've got one patient on the list this afternoon. We have a J. Perez, who's come to us with a compound fracture on his right leg. Miss Lukins, can you talk us through what you're going to do today?
Going to do some pin plating on his right tib fib. Hopefully that should be enough.
Okay, is there any anaesthetic issues that we should know about as a team?
He's lost some blood, but he's receiving a unit of red cells in the emergency department, so no, other than that, fine, good to go.
Ms Lucas, you told us what you're going to do. Is there any other concerns from your point of view to the surgery today? Okay. I can confirm our instruments are sterile and we've got every plate and the prosthesis that we need. Is there any other issues that we need to know about radiography? Are you happy with your equipment, Sandra?
Yes, I'm all happy and I'm all set up as well.
Brilliant, thank you very much. And we've got our x-rays up as well. Is everybody happy to proceed?
Yep.
Okay, let's get this list on the run.
Ronnie, time out, please. Dave, you okay to look at the wrist label for me? Can we confirm we've got Jay Perez?
Yes.
His date of birth is 14th of the 3rd, 2003.
Yes.
His NHS number is 123456.
Correct.
And his consent from the consent form 1 for ORIF and debridement of his right leg. And we confirmed it was his right leg before we draped. We all confirmed he had an arrow on his leg.
Jay, can you hear me?
Yeah.
You okay?
I'm alright.
Yeah? Okay. You feeling okay? You feel sick?
No. I'm good.
No? Any pain?
No.
No. Okay. I'm just going to check your leg, okay? That's looking okay, alright. I'm just going to do some observations, alright? How you doing there, Jay?
Alright.
You okay? All your observations are looking okay, alright. Would you like a glass of water?
No thanks.
No? Okay.
So, Jay, you're into football then?
Yes.
What football team do you support?
Wednesday.
Wednesday. Well, it's a shame, isn't it? About
Why?
Rother United, me.
Oh.
They've both gone down as well, haven't they?
Don't mention it. Just I want to forget about it
I
already.
don't know. I've got Jay Perez for you. Yeah.
Oh,
There
hi,
are his
Jay.
notes.
Lovely, thank you. Hi, Jay. Welcome to the post-op ward. We'll get you in your bed space and then we'll take good care of you.
Okay. We've had a bit of chat on the way down. Good taste in music, but bad on his football. Supports Wednesday, doesn't he?
Well, we can't all be perfect, can we?
So, where do you want him? Do you want him in Bay 1?
Yeah, B1, please. There's a menu in there for your breakfast, so if you have a look, see what you fancy, and we'll be able to sort you out some breakfast later.
No problem.
Hello, good morning. Is it Jay? Yes. Lovely. I didn't know whether to call you Jay or Mr. Perez, but Jay it'll be. Jay will be fine. So, I'm James and I'm a service assistant. Did you enjoy breakfast? Yes, very much. Excellent. All gone? Yeah, just what we like to see. Right, I'll just pop that to the side there and I'm going to wipe you down and get sorted. Did you sleep all right?
Not too bad. It's noisy.
Yeah, it is. We've got a lot going on and you can tell because it takes me ages to get around feeding everyone and cleaning up. Right, I'll just throw these all right here, Jay.
Yep, that's fine.
Yeah. Excellent. Do you want another cup of tea?
If that's okay, yeah.
Yeah. Joan, who's the volunteer on the ward, she comes round with the tea trolley. Okay. She'll get you a cup of tea in a second. Brilliant. I'll give her the nod as I go out. Oh, and I can see doctors are around corner, so I'll let you go.
Cheers.
All right.
Hello.
Hi.
Hi, it's Jay.
Yes.
Jay Perez. Hi, Jay. My name's Mr. Clark. I'm one of the consultant orthopaedic surgeons.
My name's Andrew. I'm one of the junior doctors working here.
My name's Jordan. I'm one of the trainee physician associates.
Nice to meet you.
Right. I gather that you had an accident a couple of days ago. Yes. Yeah. Can you tell me exactly what happened?
Yeah, so I was crossing the road and I was on my phone. I kind of wasn't paying attention, in honesty.
And what injuries have you sustained?
I've got stitches along here. There was a cut along my face, and I think it was a tip fib or something.
Okay. Yeah. Now, I gather we fixed this in theatre yesterday.
Yeah.
And how's it feeling now?
It feels good. Yeah.
Okay. Andrew, would you like to have a look at Jay's leg and see what you think?
All looks pretty good there. Can you wiggle your toes for me?
Yes.
Fabulous. And do you mind if I just press on?
That's fine.
Press on your foot. That's great. It's got a lovely pulse. I think he's looking pretty good post-operatively.
Good. How's the pain?
It's not too bad.
Okay. Have we given you some painkillers this morning?
Yes.
Okay. And since your operation, you've not felt sick. You've managed to eat and drink.
Yeah, I've had some tea.
Okay. Good. Now, we're considering whether it's the appropriate time to send you home. All right? I've gathered you've been keen to go home.
Yes, I just want to get in my own bed.
Well, we need to get an occupational therapy and a physiotherapy assessment just to make sure that you're safe to go home. Okay, if they're happy, then we might be able to get you home today, possibly. Andrew, is there anything else we need to do?
That's great news for you. I will make sure that you've got some painkillers to take home and some other medications to help stop you from feeling sick. We'll also give you something to prevent any blood clots in the legs.
Thank you.
And get you up and going.
Have you got anybody at home with you?
No, I live on my own.
Okay, we'll have to just make sure it's safe for you to go.
Yes, that's fine.
Just before we leave it, Jordan's one of our trainee physician associates. Is it all right if I ask him a quick question
Yeah, that's
about your
okay,
injury?
yeah.
So, Jordan, what would be the complications we need to be aware of with an open tib-fib fracture?
Yeah, well, obviously he's going to feel a little bit of pain. He's got an increased risk of infection, an increased risk of blood clots as well, and a risk of malunion.
Okay, good. I think you've covered those well. Excellent. Anything you want to ask me before we move on?
No, I think I'm good.
Okay, well, thank you very much.
Thank you.
Excellent. We'll leave you in the hands of the nurses. We'll see
Yes.
you later on.
Jane Perez?
Yes.
Hi, my name's Chloe. I'm an occupational therapist working here at the therapy team.
My nan's in a care home and she's got an occupational therapist.
We work with people of all ages, and that's why I've come to see you this morning. My job is to get you back home and see how we can make you more safe and comfortable when you're there.
Right.
So, can you tell me a little bit about home and how you was managing?
I live on my own now. Live on my own in my nan's house.
Okay.
The one in the care home.
Okay, lovely.
I used to care for it, but eventually became more than I could manage.
I'm really sorry to hear that. I bet that was quite difficult. We can look at getting you some more support if you feel you need it once we've finished. Is that okay?
Yeah, I'm fine.
Okay. So what we'll do is we'll start thinking and planning about how we can set things up at home, and we'll see how we can best support you when you get back home in the community. All right. That's good.
Hiya, Jay.
Hi.
Only me again. Brought you a cup of tea.
Oh, cheers.
You're off home, aren't you?
Yes, just waiting for the porter to come and get me.
Oh, right. Anyone picking you up?
No one, just waiting to be dropped off. I live on my own, you see.
Oh, that must be tough.
It's alright. It can be a bit much sometimes.
Have you always lived on your own?
No, I used to live with my nan, actually, but she's in a care home now.
Oh, bless you. She must have really appreciated you having you round, though, Jay.
Yeah.
Yeah. Listen, you don't seem to be yourself like you were yesterday. If you do struggle when you go home, you know, I would suggest just having a chat with your family doctor, maybe.
Okay.
Yeah. Or I know there's loads planned for you in terms of follow-up care because of your operation and that. And there'll be loads of people around at your house if you want to have a chat with them.
Yeah.
Does that seem like something that you could be comfortable to do?
Yeah, I'll think about it.
Yeah?
Yeah.
And if you do really struggle, just give us a call. All right. So I can see, actually, they told me the door to the porter, and here he is coming down the corridor. So you look after yourself, all right?
Brilliant. Cheers.
See you later. You take care.
Thanks.
Hi Jane, my name's Sue. I've come from Community Physio.
Okay.
They've asked me to supply you with some crutches for your leg, okay, to help you walk a bit better. Alright. So I'll just go through a few safety.
Yeah.
Alright. So when you're using crutches, never get up and down with them on your arms.
Okay.
Always take your arms out, okay?
Yeah.
You make an H shape. So you get up out of your chair, one arm in, other separate, put in front, yeah?
and always lead with your worst leg, which is your right leg, yeah? So if you stand up for me, I'll measure you.
Yeah.
Okay, so just pop your arm down by your side, look straight in front. Lovely, they should be okay. One arm in. Over. That's it, lovely. Okay, so set off with your worst leg and just walk as you normally would. So crutches and through. That's it, brilliant.
Yeah.
Yeah. How's that feel, okay?
That feels alright, yeah.
Right, so turn around slowly. That's it. Back to your chair. Make sure you can feel your chair at back here as you turn round. So turn round for me. That's it. That's it. Okay, so take your arms out of your crutches.
Oh.
Yeah. Both. Lovely. Reach back and sit yourself down. Put that leg out in front.
Yeah.
Lovely. Right, off we go, Jay. Yeah. Just to make sure you're safe outside. Yeah. Keep walking through with that other foot.
Yep.
Walk through. That's better.
Yeah.
Just checking, making sure. It being an uneven surface. Lovely. That's it. Walk through. Good. Brilliant. Okay. If you need to go up and down your curbs, it's exactly the same as your stairs.
Exactly the same.
Yeah, all right.
We've got a few calls to make today, starting with a full assessment of a new referral. So I thought we could go and see Jay, that young lad that got knocked over a couple of weeks ago. Community nurses have been going out and checking his dressing, but I thought that, because it's just right corner from our first appointment, I thought we could go and visit him today. Yeah? Brill, I'll just go and grab my bag and we'll get off. Hiya, Jay.
Hi.
I fetched Miriam with me today. She's a training nurse and associate. So Jay was involved in an accident a few weeks back, so we're just going to come today, have a look at his wound, and see if we can actually get him discharged.
Brilliant.
It's alright if I take your
That's
dressing
absolutely
down.
fine, yeah.
Brilliant.
How have you been?
I've been good, thanks. Yeah.
Oh, brilliant.
Just lift your foot up for me, Jay, a little bit if you can. That's brilliant. Perfect. Have you been making most of your time at home then?
Well, trying to.
Watching movies?
Yes.
Anything to recommend?
Honestly, no, nothing special.
Yeah, let's have a look. Nice and steady. Oh, look, that looks loads better, doesn't it?
Yeah, it's brilliant.
Oh, totally happy with that. Yeah.
Yeah.
Has OT and physio been out?
Yes, they've been wrong, yeah.
Brilliant. And you found them okay? They've given you some good advice?
Yeah, took some getting used to, but they've been fine.
Yeah. If there's anything else that you need, we can refer back. Just let us know.
Absolutely.
Brill. Just get you up and about then, get you back to normal now, isn't it? As quick as we can.
That's the hope.
Fantastic.
Oh, you must be really pleased.
I just want things to get back to normal.
Must be a big relief now.
Yeah.
It's healed. That's great.
Well, like Miriam says, you've got his phone number.
Yes.
So we're happy to discharge you.
Okay.
We don't need to come and visit you again, but if you need anything at all, then just give us a ring and we'll come straight out, and if there's anything we can help with at all, alright?
Alright.
Brilliant. Well, it's been nice to meet you, Jay, and
thank you very much.
Nice to come and see you again, so you
Cheers.
take care.
Hi.
Hiya, good morning.
I have an appointment with Dr. Law.
Okay, can I just get your name and date of birth?
Yes. J. Perez, 14th of the 3rd, 2003.
Okay, I'll just check you in. Yep, if you just want to take your seat, the doctor won't be long. Alright.
Alright.
Right, Jay, so everything looks good with your leg. It looks to be healing really well, and if you just carry on with the physiotherapy, that's really important as we go forward for long-term benefits of it healing properly. Is there anything else you're worried about, or you've got any concerns about?
Actually, yeah, if I can talk to you about something else, if that's okay. I need help. I didn't realise it until I was in hospital, but I've not been feeling great about myself for a while now. I think it's living on my own and my nan being in hospital. It's just a lot sometimes.
And have you ever felt like this before? Yeah. So, is there anybody you can talk to at all? No. Really, no support at all. So, obviously we're here, but there is other services and other options that we can do to help with that. Okay. Some people do think medication's the first step, but actually we prefer you to try and look at therapies such as talking therapies that can help, and consider medication after that, or we can go to medication at any point if we feel we need to. But so we have a service called IART, and it's improving access to psychological therapies is its proper name, but most people just call it IAP. Now I can refer you directly to save you trying to get in touch, but there is contact numbers on here as well, and there is a little bit of information about the service. Would you be okay with that?
Yeah, I can. Yes, that'd be great.
So I'll get in touch with them and they'll contact you directly to arrange appointments. But around that, maybe we just pick up a review in a couple of weeks. Obviously, if you felt worse, then you can come back before that. Is that okay?
Yeah, that's great. Your cup?
Oh, thanks, love.
No problem. It's so good having you back.
Do you know, Jay, it's wonderful to be back, and I tell you what, love, you really do look lovely. You look really good. You look like your old self again, and it's lovely to see it.
In some weird way, it was almost worth having the accident.
Really, love.
I just feel so much better.
Well, Jay, you've not looked as good as this as you have done in years. You really do. You like your old self again.
Yeah. That was so nice as well.
Do you know, they really did look after you, didn't they? Yeah. They really were caring.
Yeah, the mental health care team were brilliant.
I'm so pleased you managed to get some support, love. It was exactly what you needed.
Yes. Yeah.
Well, Jake, let's get back to our old routine again, eh? And enjoy it. Yes. Let's have a cup of tea.